I'm Dr. Etelzon. I'm the owner of Pain Doctors Medical. I'm here with our PA Alex, and we're here to discuss some common questions about regenerative medicine. Let's start off with the difference between PRP and stem cells. Both PRP and stem cells are regenerative products. Although they're similar, they're slightly different. PRP is obtained from your blood versus stem cells, as we commonly call it, bone marrow is obtained from some part of either the iliac crest, most commonly the bony structure of the iliac crest. The PRP is a very strong product with growth factors to help to stimulate healing. The stem cells, they have the growth factors in addition to all the cells that are really pretty much like gold that will stimulate healing on a much higher level. Growth factors are either proteins or certain products in your blood that will push your cells into that healing response. So, Alex, in our practice, which patients do you find do best with PRP versus bone marrow products, or maybe even a combination of both?
Yeah, so PRP is typically for maybe those tendon injuries, tennis elbow, LCL, MCL injuries, or the lower grade of arthritis, say grade 1, grade 2 of arthritis. You can also use it for hair, you can use it for face, you can use it for erectile dysfunction, all of those uses. Versus stem cells, bone marrow stem cells, specifically when you get to those later stages of arthritis, such as grade 3, grade 4 arthritis. You can also use it for rotator cuff tears. You can use it in the spine as well.
And I find that we have most benefit, especially in spine, coming with older people with these severe degenerative age-related changes that need surgery but fear surgery. When we combine the bone marrow, stem cells, and the PRP together, that really gives them the best results.
Yeah, I agree.
Yeah. So, Alex, you're coming more from that orthopedic background, and you assisted in surgical procedures. What would you say is the difference of how patients recover with post-surgery versus regenerative medicine?
For the regenerative medicine treatments, you still need a rehab protocol. You still need to do that physical therapy and rehab after the procedure. Doing the regenerative medicine treatments doesn't take that away. However, it does mitigate maybe the risk factors associated with surgery. You don't undergo the anesthesia. You don't undergo the risk factors of the surgical procedure itself. Maybe some of the risks, the stiffness associated with surgery. Some people also just don't want to undergo surgery and are looking for alternatives. So these treatments can help with that. They can also increase the healing time, make it faster, or improve the healing time, make it faster, and get you back to doing the things that you want to do quicker. But there is still a healing time associated with it.
Absolutely. I also find that patients after stem cells or bone marrow are really able to get back into their at least day-to-day activities within less than a week, compared to surgery where you maybe need to take off from work for months, and that really could pay a toll on people.
Yeah. I mean, for instance, maybe a rotator cuff tear. If you treat with the bone marrow stem cells, a rotator cuff tear, you do have a little bit of downtime. You're stiff, you're sore for a few days. You start the rehab protocol about a week or two after the procedure, as opposed to surgery. If you have a rotator cuff tear and you get surgical procedure, I mean, you have at least the surgery itself. You have stitches, you need to go and take the stitches out, or at least you have some type of glue. And then you're waiting at least 6 to 8 weeks to start physical therapy. So that healing time is also already decreased. And then you're looking at least 6 to 8 months of physical therapy after rotator cuff surgery, with the risk of adhesive capsulitis or stiffness of the shoulder or post-surgical complications.
And not to say we work with surgeons, and exactly. For some patients, surgery is it. But if we can at least avoid, or even if that patient undergoes surgery, regenerative medicine is known to help even after that shoulder or whichever surgery to help them get back.
And speed up the healing time.
Speed up the healing.